Yeah, so nasal obstruction is another symptom that is highly correlated with sinusitis and allergies. Um, I think broadly, it's easy to categorize nasal obstruction into two. One would be problems of swelling, such as sinusitis, allergies, etc. And the other would be structural problems. And so one of the challenges is figuring out which of those is the dominant factor in a patient who's struggling to breathe through their nose. And honestly, they work together to cause symptoms. So folks who are struggling with difficulty breathing through their nose that is strongly one-sided, that would suggest a structural problem, simply because causes of nasal swelling tend to be more diffuse and affect both sides of the nose and sinuses. Um, but that's not the only factor. And some people will describe alternating obstruction of the nose, one side or the other. That's actually a physiologic phenomenon. So we actually, believe it or not, really don't breathe through both sides of our nose at the same time. Typically, we breathe through one side for 90 minutes or so, and then it alternates to the other side. I don't think anybody really knows why that is, but that's just an interesting phenomenon. And yet we're largely unaware of that change. It's called the nasal cycle. And if each side of the nose is open, then we will not really be aware that that cycle is occurring. However, if our baseline is poor and for whatever reason, structural or because of mucosal swelling, either or both sides are narrowed, then we can be very acutely aware of that alternating cycle. And so really the challenge for the physician is to determine what are the most dominant factors that are contributing to the nasal obstruction. Again, is it structural? Is it related to swelling? Typically, we employ medications to reduce swelling as a primary treatment option, because much of that, even if there's a large structural component, if we can reduce the swelling enough, that may be enough to reduce the patient's symptoms so that they're significantly less bothered by the structural issues. However, when a patient has not responded to medications to reduce nasal swelling, then we consider structural issues that sometimes require surgical management. So it's really just a matter of evaluating the condition that the patient presents with, as well as evaluating the inside of the nose for potentially symptom or findings that don't respond to medical therapy, and addressing those.